First, the clinician will test the olfactory nerve by asking the patient if they can smell coffee from each nostril individually.
Okay, so first I'm going to test your sense of smell. I'm going to have you close your eyes for me. And can you plug your right nostril and smell that for me? And can you smell what that is?
Coffee.
Okay, and plug your other nostril. And we're going to smell with this side. Can you still smell that?
Yes.
Great.
The clinician will now test the optic nerve by checking her visual fields and having the patient read a letter chart.
Okay, so I'm going to have you read the vision chart for me. If you want to turn and cover your right eye, read that top line for me.
CHLRBD.
Great, and can you cover your other eye? And then read the second line.
FABOL.
Good. Okay, and now I'm going to test your visual field. Tell me when you can see my finger.
No.
Great, and I'm going to try your other side. Tell me when you can see it.
No.
Awesome.
To assess cranial nerves 3, 4, and 6, the clinician will have the patient follow her finger to assess for lateral and medial strabismus and other motor eye movements.
Okay, so I'm going to have you keep looking straight ahead and follow my finger with your eyes. Okay.
The clinician will now flash a light over each pupil to test cranial nerve 4 function.
Okay, and now I'm going to test your pupils here. I'm going to have you cover your right eye. Okay. And cover your other eye. Awesome.
To test the function of the trigeminal nerve, the clinician will touch the patient's forehead area, midface, and lower face with a cotton swab and ask the patient to open her jaw to check for deviation.
Okay. And can you feel this?
Mm-hmm.
Can you feel that?
Mm-hmm.
And can you feel that?
Mm-hmm.
Great. And then I'm going to have you open your mouth nice and wide for me. Awesome.
The clinician will now assess cranial nerve 7 by having the patient smile and frown. She will also touch the patient's anterior portion of the tongue with a cotton swab that has lemon juice on it to test her taste.
Okay, now I'm going to test your facial expression. Can you give me a nice big smile and a frown? Okay, now I'm going to test your taste. All right. I'll have you stick out your tongue for me, and we're going to see if you can taste this. Can you tell me what that was?
Lemon.
Awesome.
The clinician will now test the facial and vestibulocochlear nerves functions by moving her fingers together close to each of the patient's ears. She will also ask the patient to stand on one foot to assess her balance and equilibrium.
Okay, so we're going to test your hearing here. We'll do one ear at a time. Tell me if you can hear this or not.
Mm-hmm.
And this one?
Mm-hmm.
Awesome. Now it's the tricky part. I'm going to have you stand up for me. You're going to stand on your right foot and touch your nose with your right finger. And switch it. Stand on your left foot, one foot. Beautiful. Go ahead and take a seat.
To assess cranial nerve 9, the clinician will put lemon juice on a cotton swab and touch the posterior portion of the patient's tongue. She will also place the tongue depressor towards the back of the patient's mouth to test her gag reflex.
Okay, so we're going to do our taste test one more time here, just with the back portion of your tongue. I'm going to have you tell me if you can taste this or not. Open nice and wide. Can you taste that?
Mm-hmm.
Awesome. Okay. And now's the not so fun part. We're going to test your gag reflex here. Open nice and wide for me again. Awesome. Good work.
The clinician will now look at the patient's uvula for deviation and have the patient say "ah" to assess the quality of her voice. This tests the function of cranial nerve 10.
Okay, we're going to check out what's going on here. Open up. Awesome. Perfect. And can you say E, E, E?
E.
Thank you.
To assess the accessory nerve, the patient will shrug her shoulders and turn her head to both sides.
Okay, so first I'm going to have you shrug your right shoulder for me, and shrug your left, and turn your whole head, look to the right side, and look to the left. Very good.
The clinician will now have the patient protrude her tongue and move it from side to side to test the hypoglossal nerve. She will also have the patient read a sentence to check for dysarthria.
Okay, so I'm going to have you stick your tongue straight out for me. Okay, and can you move it side to side? Okay, and then last thing here, I'm just going to have you read this sentence right on the top line there.
The man walks his dog at the park.
Thank you.
The patient displayed a weak voice and slurred speech, indicating dysarthria, which is a characteristic of those with damage to the hypoglossal nerve. When asked to protrude her tongue, the patient deviated to the left, also indicating a lesion of the hypoglossal nerve on the left side. All other cranial nerves are functioning normally.